Well, the World Health Organization is urging countries to fully vaccinate their populations in an effort to fight a surge in COVID-19 cases. The world body has also advised countries to boost their healthcare capacity. Some countries are facing a rise in coronavirus cases driven by the Omicron variant. South African scientists were the first to identify and report the variant. Following this, several southern African countries face travel bans. The WHO says the travel bans could buy time but are not the answer. We're now joined by Dr. Bharat Venkanya, Senior Clinical Lecturer at the University of Exeter in Medical School in Bath in the UK. Thank you so much for joining us, Doctor. How is the spread of the COVID Omicron variant? Is it possibly linked to vaccine inequality globally, even though there are a lot of scientists that have said that they don't know where it originated from? South Africa was the first to detect it. But has vaccine inequality anything to do with it?
Yes, good evening to you in Kenya. There are many parameters that lead to the emergence of such variants. And one of the key issues, one of the very big key issues is wherever you have an infection, wherever you have an infection that is prolonged and continuous and in many people, then variants can arise. So in Africa, you have the correct all the circumstances put together, i.e. a under-immunized population, lots of infections in immune suppressed people. So you have the ideal ingredients for a variant to arise. And that is such an unfortunate thing that we already knew could happen. Unfortunately, we could not immunize sufficient Africans in time to prevent such a thing from happening.
Doctor, what would be the best way to fix the disparity in access to vaccine across the world?
This disparity is very unfortunate, but it has been there for many, many decades. And what COVID-19 has done is put a spotlight upon it. And people are waking up to the long-standing disparities in healthcare delivery to Africa compared to Europe. So what we have to do is we need a stronger WHO. We need the richer European American nations to agree and accept that we need to live and work in harmony with our poorer brothers and sisters in other countries, because what happens in Africa can happen to them one day. And if we live in partnership, we can do things better. So with respect to vaccine supplies, it is not only a question of donating vaccines. We have to enable the poorer countries to set up the logistics, the needles, the syringes, the swabs, the logistics, the transport, the safe storage, the cold chain. All of these things need to be assisted by the richer nations. And finally, we also need to get the African leaders to look after their own population by promoting vaccine and doing all they can to reduce vaccine hesitancy, because vaccine hesitancy is also a big issue.
Doctor, I was just reading a report before coming on air, and it was coming from Dutch health authorities who were saying that some of the South Africans that they found with the Omicron variant, or had found that they were COVID-19 positive, had been vaccinated. Before they had actually gotten their flights, they tested negative for COVID and then tested positive in the Netherlands. And the Dutch authorities were just saying that it just shows how quickly this virus is spreading. So beyond people being vaccinated and all the testing that is happening, what else can governments do to curb COVID-19?
Well, none of us are well until all of us are well. And we need to work globally at reducing cases. So instead of European nations immunizing and then boosting their populations, they should be simultaneously also immunizing other parts of the world. That way, you keep case numbers down, you keep variants emerging down, and together we reduce case numbers, together we make it better. It will never work unless we do it together across the globe simultaneously.
Thank you so much for your input, Dr. Bharat Venkanya, Senior Clinical Lecturer at University of Exeter Medical School in Bath, the UK.